It's time to sit back, relax, and listen to Conversations with Joan. Conversations with Joan will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life's Conversations with Joan. I'm Joan Herman. Thanks for tuning in. Conversations with Joan focuses on topics that are important to your life, from health and wellness to professional development to personal well-being. Change makers join me to share their insights, tips, and strategies so you can thrive and live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. Now, let's start talking. Finding out you have cancer can be devastating. Feelings of depression, anxiety, and fear are common. Today's guest, Mary Battaglia, was diagnosed with chronic myeloid leukemia. For years, Mary has helped her clients navigate their health challenges. Now, she faces one of her own. Mary is a certified hypnosis practitioner, founder of Metro Hypnosis Center, and author of the book, Transformation Through Hypnosis, Relax, Clear Your Mind, and Step into Your Power. Welcome, Mary. Thank you so much for joining us.
Thank you, Joan, for having me.
Mary, you and I have been friends for some time, and I'm really happy that you're coming on the show today to share this journey that you were forced to embark on. But I remember the day that you called and told me you had leukemia, and for me that was a scary day because, as you know, I have a brother who passed away from leukemia, so I come from a particular frame of reference whenever I hear that word. But let's talk about you and your story, because it is really a story of hope. So what led to the diagnosis, and was it something you were suspecting?
Well, I needed to get my checkup, my annual physical checkup. I hadn't done it in about 2 years. With COVID, I think a lot of us had put off some of our healthcare needs. And I've also had a mom who had been sick and who had passed last year. So my time of dealing with that and cleaning up the house didn't give me time to do some self-care or going to the doctor. So the end of that year, I made my appointment, and I wasn't feeling myself. I was noticing a lot of bruising, but I was cleaning up my mother's house and was moving a lot of things, so there was a reason for that. I was feeling really tired, but I was going through grief, and I was thinking that's probably part of it. It was a long year for me. And I was noticing some shortness of breath. I just thought, well, maybe I'm just out of shape. So I went for my physical, explained my issues, and my stomach was starting to feel very uncomfortable at that point. I was feeling very tight. My stomach felt very bloated. So I was mentioning all of that. She took my blood work. She, gave me my exam. And then a few days later, when my blood work came back, she called me and told me that I had a high white blood count, and she said she thought I needed to go to a hematologist. And then she also told me that I was anemic, that my liver functions were affected in the blood work. And she talked about the shortness of breath being from the anemic, and that the bruising was all symptoms of leukemia. So she said she wanted me to go to that doctor, and then I said, well, how high is my white blood count? And just to give you a range, Joan, it's 4 to 10,000 is the range that most people's blood work, their white blood count would show up. Mine was 90,000, and that really impacted me. When she told me that, with so many other things, I was like, okay, but when she told me how high the white blood count, I was like, wow, that's pretty high. I went, so she told me that I needed to go to the hematologist, so I called, and it's really, you just don't get an appointment right overnight. So it took a week for me to get into the doctor's office, the hematologist's office, and in the meantime, what do? You Google and you research everything. And by the time I went for the first doctor's appointment, looking at all the symptoms of leukemia, it really did look like that. My spleen was really enlarged and things like that. So I kind of knew going to the doctors that was going to probably be the diagnosis.
Everything you were experiencing, and I remember you telling me all of these symptoms of the various things you were feeling, and we were very easily explaining them away, as you said. So when the doctor used the word possible leukemia and you did your homework and leukemia started showing up and you started to think, I may really have this, what were you feeling at that time?
It felt like to me that someone sideswiped me and I was on the shoulder of the highway because I wasn't driving on the same road anymore. I was, it was shock, and not that cancer was shock in general, but I've had a lot of family members. My dad passed away of lung cancer, my sister passed away of breast cancer. So I've been caretaker, and I kind of understood that type of cancer. But a blood cancer is different because when you have that, it's going throughout the whole body. It's all going through your bloodstream. So I was confused. I have to say I was confused. I was shocked. And it took me a day or two to kind of really start thinking that this was a possibility. Because I think we normally push those things away mentally. I think we want to just reject these things. So it took me, I'd say, like 2 days to realize that and let it sink in, because it does need to sink in, because it is a shock. And I didn't tell anyone. I didn't want to talk about it to anyone. I wanted to understand. I wanted to get more of a diagnosis. But I felt such sadness. I'm not someone who is afraid of dying. So fear of dying is not something that was driving me. It was a sadness. And I think there's a grief that we're feeling. And as I was getting closer to the doctor's appointment, the sadness was coming in like a wave of grief. And it would well up in me, and it would be this amazing amount of sadness of going into tears. It's like really deep crying. And it really shocked me, because I am someone who feels that I'm in control, and I do hypnosis. And let me tell you, if I didn't have my tools, Joan, to get through this time of relaxation, of clearing my mind, of dealing with the sadness and bringing in healing, I took charge. Once I accepted that this could be the diagnosis, I started working on myself. I went and created a script already for myself of healing. So I felt that really helped me take charge, and it made me feel like I was empowered to do something, and that was really important to me.
So Mary, you went to the hematologist, and what did the doctor say to you?
So I went to the hematologist, and they couldn't give me an actual diagnosis that day. They needed to do more blood work. But again, it was all pointing towards that. And my blood work was, my white blood count was 90,000. Originally, it went up just less than 2 weeks. It went up to 130,000. So, that was not a good thing, that it would keep going up. And I was I'm a holistic practitioner, and that's kind of how I like to approach my life. So I was trying to explain to them my approach to life, and how I wanted a team, because I am a holistic person. And they told me that I was going to have to start a chemo drug right then and there, an oral one. And I told them, I don't know if I can do chemo. As someone, as a caregiver who's watched the process of cancer, I didn't realize I was still traumatized from some of that. So I told them that I would pick it up, but I wasn't sure I was going to take it. And get this, I'm going to start a chemo pill. I don't have a straight diagnosis. That's a little nerve-wracking to do that. Understanding that the white blood count is going up, we had to do something to help me. But I wasn't ready to accept that. And I wouldn't have taken the pill without being able to accept it and have it help me the way I think it did help me. So I picked up the medication, and I was really in shock. I think it really shocked me, that the chemo, and like it was happening so quick. Then a labyrinth is something that I walk, a labyrinth. There's a place near me that has one. It's kind of like a maze, and you just kind of walk a path. It's a very direct path, but there's an exit and everything, and I find it very peaceful. So I immediately drove up there to calm myself down. And mind you, all of the time of going into the doctor's office, I was doing my self-hypnosis. I was keeping myself calm and relaxed as much as I could. But once I had the medicine, so I walked the labyrinth to calm myself down, and it kind of gave me a little plan for me to do. So I have a very good friend that's a nurse practitioner. I hadn't told her. I had one friend that found out that I was that this was happening to me because she kept saying, "You don't sound yourself," and then it just came out. But I didn't want to burden people. You know, you kind of feel like you're burdening people with this information. And so I had to go to my friend because I needed a little counsel at that point. I needed some medical counsel. And I'm lucky that I have someone that I can do that with. And, you know, she said, "Well, what's your diagnosis?" I said, "We don't know yet." So I decided not to start taking that medicine that day. My friend who's a nurse practitioner is also a Reiki practitioner. And she did a little Reiki, which is just really energy work to help release some of probably all the chaotic energy I was feeling at that point. So it really calmed me down, and it really gave me such great peace. And what's really important when we're on a journey of cancer, any health thing, is that we find things that can help us be calm and handle what's coming our way.
I remember, Mary, once you did get the final diagnosis, I happened to be at your house the day the final medication arrived, what they decided to put you on, and you can share that with us in a moment, what they decided to put you on for the long haul, for your treatment. And would you share what we all did? Because I had never experienced anything like that. When you had the medication sent to your home, you had you conducted this little ritual with this very small group of us. And would you share what that was and why that was so important?
So just a little preface to getting there. So I had to work on myself with accepting the medicine because, again, I'm someone who does not want to take medicine if she doesn't have to. And chemo, to me, the word chemo, pill, just kind of put on a higher alert. So I actually did, through my hypnotherapy work, I did a lot of work on myself to get to the point where I was accepting and that I could look at the medicine as something that was going to help me. This is something I've done with people, many clients, with chemo or with any type of medicine. I've done different type of sessions with welcoming the medicine. So I had done that for myself, but what you're referring to is when you were at my house with some friends, that was the day the medicine came. And I had, in my mind, accepted that this is what I had to do to get better because I had looked at all other options and there really wasn't too many options at that point. And I found another doctor that I really liked, and I felt really comfortable with the decision of which medicine we were chose to target my chronic myeloid leukemia. So what I did is I had the medicine bottle out, and I did my own little ceremony, if you want to call that, a blessing is what I kind of call it. And so I blessed it, and in my mind, this was like a golden pill. This was part of my healing, and that's how I looked at it. And then everyone who was there did their own blessing of the medicine for me and towards me. It was just so beautiful. I don't know how else to explain that, Joan. Mm-hmm. What was it like for you?
It was, and it has really stuck with me because I think what you're talking about, the welcoming of the medication, no matter what it may be, we're talking about chemo here, but it could be any type of medication, because the first thing we normally do is we look up the side effects and we look up all the things that can possibly happen to us, and then we become afraid of the medication. And I think on some level that hinders the effectiveness. I remember a number of years back I did an interview with Dr. Bruce Lipton, and he talked about the nocebo effect, and he shared a study that was done on cancer patients. One group in the study received chemotherapy medication. The other group received an IV of saline solution. The group that received the saline did not receive one drop of chemotherapy medication, but had all of these preconceived notions in their minds about what chemo would do. The group that never received the medication exhibited chemotherapy side effects, nausea, hair loss, and the list goes on. So The fact that you're teaching all of us to welcome, to bless, to accept the healing medication into our bodies, I think we're then adding to the effectiveness, because yes, the medication has a role, but I think we really have a big role in our own healing.
Oh, 100%. We do have a big role in our healing. And even to this day, when I take my medicine, I take it once a day, I express gratitude. I thank it for coming into my body and helping me heal. And then I ask it to take out the toxins right away, right? So the mindset is very important. So taking the medicine is now I'm open and ready to receive its healing instead of being resistant to it. And anyone, even if you're doing an IV infusion, and it doesn't have to be chemo, it could be any medicine you're doing. Even if you're in a place with an IV, you can, in your mind, send a positive thought. It doesn't have to be a prayer or a blessing. It could be a positive thought. It could be something as simple as just you saying it in your mind, or you could ask the staff if you could hold it. I don't know if sometimes might not be able to hold something with the medicine in it, but if you could maybe just send those thoughts right before you're going to get the IV or the infusion in, just, take a moment to ask them, take a moment to get yourself set up for it so that you can set yourself up for receiving healing. And if you look at it that way, it can really make quite a difference in your healing process, because now you're putting that thought that I'm open for healing instead of the fear. And I remember when my sister first got IV chemo, unfortunately I didn't have all this knowledge. I just remember how scared and petrified we were, because it's a scary time and we don't know how to navigate these things. So if we all kind of put a little more positive spin, and it doesn't matter, it could be a diabetic medicine or blood pressure medicine, it could be any medicine that you're doing that with. If we look at it that it's supporting us and helping us, and negative that I don't want to take it, really can make a big difference.
Mary, was there ever a time when you identified as being a leukemia patient? Because when we take on that role of the sick person, we begin to live our life as a sick person. So did that happen to you? And if it did, how did you combat it?
Well, I tried to say and speak about it as a diagnosis. I tried not to own it. I find that by saying I have cancer, I have leukemia, I'm starting to own it and have it become part of me. I don't want leukemia to be more than part of me than it is already. So referencing it to that is a really important thing for me, at least, and how I approach it. I kind of see myself, this is how I've seen myself, is driving in a car and it's in the side view mirror. I don't want it to be ahead of me. I want it to be on the side, because it is something I'm dealing with. I can't, not to have it part of my life. It's there, but it's in the side view mirror so that it's in the background. It's not taking over my life. And I think, unfortunately, when we have illnesses and diagnoses, we kind of let it take over our lives. Now, I had a lot of fatigue. I had a lot of tiredness. I couldn't keep up a normal schedule at that time for a few months. And I was probably a little flat. And there's a little sadness that goes with it, and probably a little depression at times. But having tools, like I have tools for hypnosis, I would actually, besides my own recording, I would actually visualize every day, almost like a hand coming into my bone marrow, because that's where the white cells the bad ones are being produced in my bone marrow, which is sort of the lower back. And I would imagine a hand coming in and scooping out the bad cells. And I have to say, as I got closer and closer and I was seeing more progress when I would go for my doctor's visits, I was seeing in my visualization that there wasn't even that much left. And the last time I went to the doctors, I have less than 1% being produced in my body, which is a really big deal. It's about 6 months, and I went from 50% in my body when I got diagnosed to now I have less than 1%, and I feel much better. My energy is there. I still take the medicine, but to me it's tolerable. And that's, again, we can create a mindset to help support and tolerate what we're experiencing.
How much of a role, Mary, do you believe you've had in your healing?
Joan, I used to think that healing was all up to me before I was diagnosed, and it is important. My role in my healing is extremely important. My mindset, my approach to life is extremely important. But what I've realized is the support I have around me and the love around me has been invaluable. I am so lucky as a holistic practitioner to have people do Reiki and magnifying healing. I do acupuncture. I get the acupuncture done to help with my stomach tightness, and I have friends that are medical intuitive. So I just brought everyone in that could support me. So my outlook and my approach is extremely important. But the team I've created, including my doctor and the medicine I'm taking, so it's a team effort to me. I used to think it was all on the person healing before. And though there's a lot of important roles I have to my healing, and I am so empowered with the work of hypnosis, and I've seen myself and see how people can change your mindsets with illnesses and things like that. So I knew all that was possible. I knew that I could approach this in a better way. But we still get depression, sadness, we still feel uncomfortable, we still feel that. But you can approach it and deal with it in a manageable way.
So it's really important not to isolate yourself.
That's a really good point. And I think that isolation, it's like I hated to tell someone what was going on. I know.
I remember I was so angry at you because you didn't tell me at first.
Yes, no. And I really, because I know as a caregiver, I know someone who's been on the other side as a caregiver, how that affects them. And I felt everyone's shock when I told them this. And it was emotional for me to have to tell people and go through it. And especially, I had to tell my sister. I wouldn't tell my sister until I knew what kind it was. Once I knew it was chronic, I felt better telling her that, because chronic has a lot of positive, chronic leukemia has a lot of positive things to it. So at least I felt better telling her this news than when I didn't know it. And we went from a family of 5 10 years ago to down to just the two of us. And just losing my mom in the last year, and both of us were very important caregivers to her. I didn't want us to go through another caregiving role. I just didn't want that. I was upset about that. I was never angry about the diagnosis, but I was upset at how it affects other people. And I'm sure a lot of people feel that. I didn't want to have to worry about someone taking care of me. So we need to welcome that people love us and want to help us. And luckily, I was always able to be active enough and take care of myself in my home, but having people come in and bring a meal here and there or bring supplies and, was very, very helpful. But it's the love. It's the love I've received from so many of my really dear friends.
And Mary, very quickly, before we run out of time, what do you want to say to someone who is newly diagnosed?
I want to tell you to take a deep breath. I want to tell you that you can get through it. I want to tell you that you are strong enough to do it. And I want to tell you to let people help you, because you are worthy and deserving of healing and getting better.
Mary, thank you so much for joining us today. I know how difficult this is for you. You're a very private person, and for you to come on the show in such a public way, it really means a lot to me, but I know it's going to mean a lot to so many people who are struggling with whatever challenges they may be facing. And I've witnessed where you've been in this journey over the past months, and I think that everything you teach and everything you practice, it's making the world of difference in your healing, and I know it will in the lives of so many people. So I am honored, and I'm so happy that you're here to share this with us and that you've chosen me to make this announcement. It really means a lot to me, and I know it means a lot to our audience.
Yes, and thank you, Joan, for having me, and allowing me this platform to share, because someone out there that's listening today is newly diagnosed or might be in the middle of it.
If our listeners would like to get more information about Mary and her work, or if you'd like to get a copy of her book, Transformation Through Hypnosis, Relax, Clear Your Mind, and Step into Your Power, you can visit metrohypnosiscenter.com. Mary, again, thank you so much for being here.
Thank you, Joan.
Thank you for joining us. I hope you found the show informative. At At Change Your Attitude, Change Your Life, we believe that knowledge is power. Take what you've learned, apply it, and live your best life now. Remember that the information provided is the opinion of our guest and should never replace the advice of a professional who knows your personal situation. If you'd like more information, visit our website, cyacyl.com. That stands for Change Your Attitude, Change Your Life. While on our site, listen to past shows on demand, read the digital magazine, sign up for our mailing list, and be sure to follow the show on social media. Until next time, this is Joan Herman. Thanks for tuning in.